sexually active persons are always willing and eager to adopt a form of child spacing method, but due to achieve fun and maintain a healthy lifestyle, but due to several side effects out there picked from friends or colleagues, they stay away from these methods, bridging what they are actually looking for. Words of mouth, myths, misconceptions about these child spacing methods usually make people, especially sexually active persons, avoid these methods. They pick all of these from their colleagues, friends, like I said earlier on, serving as a deterrent to their healthy lifestyle. And you know, when we talk about side effect is actually one or two problems arising from a particular procedure picked from a method. And usually, oftentimes, probably, you might not even pick up that side effect recommended or shared by individual A or individual B. Let's say I adopted IUD and I am experiencing headache as a result of that. There's every probability that you as an individual will not experience that headache, will not experience that cramps, because body differs, body system differs. And so today on Contraceptive Matters, we are actually looking at side effects, how to manage these side effects. We want people to go out there to pick up a form of method, if any form of modern method out there without fear, without having any fear about side effects, headaches and all that, because body differs. On this note, I welcome you to Contraceptive Matters. I'm Olasumbo Modupe. Please stay tuned. The program continues shortly. So what exactly is side effect? Side effect is actually a period, or let's say a duration when a body is trying to adapt to a method that was, adopted. Let's say, for instance, you adopted a form of child spacing method like IUS, or one of the hormonal methods we have out there, and you've been experiencing, let's say, headache, you've been experiencing heavy flow or cramps, lower abdominal cramps. This is what we call side effect. But members of the public, let's say your friends, colleagues, families, might have, how would I put it? Might have aggravated the side effects. And you know what? Probability is out there. You can actually not experience what Mrs. A is experiencing as a result of the same method. Just go out there to your healthcare provider, talk to one of them, and you can actually pick one of the methods out there. And by chance, you might not even experience what we call side effects. And to discuss more about side effects today, I have with me Dr. Queen Amina Baku. She's a family planning expert. She's going to do justice to all the I won't call them side effects anymore, because I feel they are myths and misconceptions, because it's just for a particular period.
Okay, well, maybe not all myths, but there are misconceptions around family planning. Because some people, these side effects can be really real for some people, but for the majority, because like you said, they've been exaggerated, they've heard so many things about this. Even when they're not feeling it, there's this psychological thing that this is what I'm feeling if they told me, or So yes, there may not all be myths, but there are a lot of misconceptions, and I guess that's why we're here today.
And this has also served as a death sentence to most people's reproductive health system. Just because the fear is there. Yes. And so let's start with emergency contraceptive pills. What are some of the side effects that we have, and how do you go about them?
So emergency contraceptive pill, an example is a post pill. So common side effects usually are changes in your menstrual pattern. So some people may find out that their periods are absent for longer or lasting longer than usual. So especially if you're a repeat user, you may find out that you don't see your period for longer periods. And remember, it's called an emergency pill. So if you find yourself taking it more often than you would expect,
just one-off.
Yes, it should be something that you take occasionally, or something unexpected happened and you needed to protect yourself at that time. So another common side effect people complain about may be nausea, vomiting, and like most hormonal, something to do to mitigate this is to take it with a meal, or to take it at bedtime. Okay, another side effect people may also complain about, I remember I said that these are potential side effects. You may or may not experience them at all. Breast tenderness, that means your breasts seem a bit painful. A lot of women have this even before their periods are about to start. It's part of the premenstrual syndrome that some women may experience. So if you experience this, first things first, be sure you're not pregnant. Remember that there's no 100% except abstinence. So you have to be sure this isn't pregnancy. And when you're certain it isn't, you also need to talk to your doctor to rule out other more ominous things that may be happening. Otherwise, these are transient, they will pass. And if you have to use analgesia, then please do. Headaches, some women also complain about headaches. You're over the counter. The hormonals usually have similar side effects generally. Your over-the-counter mild pain relief usually takes care of this. So these are some of the common side effects we have with
what about
emergency
nausea?
pill. Yes, we talked about nausea, vomiting. I said to take it at bedtime or with meal. Yes.
Okay, let's look at daily contraceptive pills, also known as oral contraceptive pills. Are the side effects similar to
very similar? Very similar. Like we said, most of the hormonals, their potential side effects overlap. Okay, so for the daily contraceptive pills, DKT brand is a level firm, as you know. Okay, so like we said, you may find out your periods are lighter, which most women enjoy, which is one of the non-hormonal. This is one of the non-hormonal advantages of using contraceptive pills. So those who really have heavy flow and you've seen your doctor, you've ruled out other issues, it gives you the advantage of lightening up your flow. And then the period may actually be less painful, which most women actually enjoy, okay? Some women also, the regularity is slight, weight change, but the hormones in this level in our contraceptive pills are really low. So the changes in your weights are not really significant. Nausea, vomiting, some women complain about that as well. Use with meal, use with bedtime. At bedtime, headaches, over-the-counter contraceptives will also help with that. Some women complain of some abdominal discomfort. It's really very rare, but I've had clients who actually complained of that. But remember that for most of these things, in few weeks to maximum 3 months, like Tumba said, your body is trying to adjust, okay, yes, to this method you've embraced for a reason. And, so have that reason at the back of your mind before you toss it. But if it's really unbearable, talk to your healthcare professional. There are things that can make the transition easier. And if it's absolutely unacceptable, there's always an alternative we can introduce. So these are some of the common side effects you have with the contraceptive pill.
Okay, let's move to contraceptive injection.
Okay, so contraceptive injection, DKT Press. Okay, it's our brand of contraceptive injection, and the great thing about it is that yes, formerly called Cyano Press. Okay, so these are the how will I say it, for our brand, because the hormone in it is minimal compared to the traditional brands. What you have in it is much lower, but the same efficacy, so less side effects. But still, you may find out that some women complain of spotting. That means that in between, you just find that there's some stain, okay? Some women actually have longer bleeds. Some women have no bleeds at all. So do not panic. We keep saying
experiencing no bleed.
Yes.
Does that mean it's storing up? Because I've heard that one of our viewers asked where it's actually storing up.
Honestly, I found that women are emotionally attached to their periods. I think there's this, now that's where the myth may come in now, this myth and misconception that, oh, you're not seeing your period, something. Yes, something may be wrong, but remember, for a woman, stress, weight gain, weight loss can actually throw off your circle, okay? And usually when we come in and find that there's nothing to worry about, be sure you're not pregnant. We keep saying that that is first thing we think about when a woman who's been having regular periods suddenly comes in. We need to be sure. So don't get offended when your doctor says, no matter what you tell me, I want to do a pregnancy test, don't get offended. But that's the first thing we need to rule out, yes. Because people tell us a lot, and then you see that this person is pregnant. So, and then you've been, checking for other things when the solution was simple. So you check for other things, but usually if you're not on a contraceptive method and there's nothing else that could explain why you're not having your period, okay? If it continues for 3 consecutive months when you've been having a regular period, we will want to investigate you thoroughly. But like we said, apart from that, except there's a disease condition that has been spotted, it isn't something, it doesn't say you are ill or less of a woman or less of a female, okay? And it isn't a sign of ill health, and it's not accumulating somewhere. For those who've had conditions where fluid or blood accumulated in their abdomen, say it's a tight space. Even if you think you have a big stomach, it's a limited space, So if you have
size,
not by the size. So if you're having blood accumulating somewhere, do not say, oh, that's why my tummy is bigger. When I started this, that's why my tummy became big. That's fat. It's not, nothing is accumulating. You'll have pain, there'll be a lot of discomfort. That becomes an emergency. Okay? So it's not, usually some women, their periods come back, it may be lighter. That's another thing women enjoy. For those who've had heavy periods, they're not complaining about light periods at all because they've been at the other end of the spectrum. Okay, so other things may just be headaches still. We've talked about that. Okay, headaches is really a big thing. Change of mood is another thing some women complain about. Some people have really heavy bleeds, heavier than expected. There are things your healthcare professionals can give you to lighten those bleeds. And if it persists, like I always say, or it becomes unacceptable for any reason, there are alternatives that you can be counseled on and you can pick. Okay, so those are some of them.
Okay, what about implants? Now that we know that most of these side effects are not harmful, what about implants?
So, like most hormonals, implants, okay? We have an implant on NXT, we have Jadel, okay? One for 5 years, the other for 3 years, okay? So these are the things that we want you to know about the implants. Apart from the other things we've talked about, another thing that might be common with the implant is the loss of libido that some women complain of. They're not just interested in any sexual activity of any kind. And you can imagine that that could be a stress in a marriage, in a relationship, okay? Wow. But talk to your doctor about it. Now, everything is not all drugs. Drugs are not solve all things, Sometimes just counseling between the husband and the wife just helps sort that out. Knowing how to manage the situation and what to do, behind doors helps you to sort that out. And if necessary, the natural supplements proven to help, okay? Proven to help. That just sort that out. It's not enough. Like I said, have your goal in mind. When you know that I'm doing this because I'm not ready to have children, I have a plan, I have a goal, whether a health goal or an academic or professional goal or something. You've completed your family or financial target. You think about that. women even go through worse to get their hair done. Even with the pain, you still want to have your hair done or some other procedure. So if you have that goal in mind, some of these things are transient. That means they will pass, or, you know, there are things that you can actually live with without being bothersome. And if they are extreme, there's always a way out.
Okay, we've talked about most of all these side effects arising from most of the hormonal.
Yes,
Before we go ahead to the non-hormonal, I would like viewers to call 09087296673, 0908-729-6673, because this edition is actually about you. We want to allay your fears. We want you to know that if you're adopting a child spacing method today, you're safe. It's just for you to make a smart choice. There's nothing wrong about that. I'm sure your friends might have told you how you know what, you're going to experience headache, you're going to experience menstrual cramps and so many other things. Be free to adopt any other method out there. So you can call 0908-729-6673, 0908-729-6673, or send your WhatsApp messages to 0809-027-9018, 0809-027-9018. Please share your thought with us. Let us, we have a doctor in the house today. We've always been having doctors in the house. So we want to hear from you. We want to know the side effects you are experiencing, or let's say you are imagining,
or you're afraid of experiencing.
Because most people might just imagine, okay, because BC said I'm going to have this, I think I'm already having, even without the method. So please call in, and I want you to know that this program is made possible by DKT Nigeria, one of the largest and private providers of contraceptives, child spacing methods, and reproductive health products in the country. We try to encourage women especially and family to adopt child spacing method, modern child spacing method. We encourage you to make informed and smart choices when it comes to child spacing method, thereby reducing maternal mortality rates and also improving your welfare and your well-being. You know, the woman actually owns the nation. The woman actually owns the family. When a woman is healthy, the family will be healthy as well. So let's look at changes in mood. What about mood swings?
Yeah, we talked about that. Mood swings, some women actually experience that. And even without contraceptive methods, females can naturally be moody. It's just hormonal. It's the hormones we have. Some men are moody. But it's more common in females because of the hormones. I remember that these methods are synthetic hormones. So they simulate what your body already has. So you may have mood swings. Yes, I've met some women in which it's been quite severe. You know, it's almost as if they had a personality switch entirely, and we had to put them on something else because nothing was helping. But usually, if you have it at the back of your mind that on a normal day, just before your period or while you're pregnant, there could be some mood changes, okay? But other things could also cause the mood changes. The woman may just have her body changing. That's why you must talk to a healthcare professional to put a finger on what the issue may be. Don't immediately tie to this method that you've adopted. It could be hunger, it could be stress from work. Yes, it could be, you know, some insecurity with your body changes. It could be some issue with your spouse or something. You know, there are so many things that could give the same side effects. Even when we talk about headaches, nausea, all these things we're talking about, even malaria, some of those conditions are common in our area. A flu can give you those things. You need to have your eyes checked, and this headache, you think it's the contraceptive method, and it's just because your eyes are strained. So you have to rule out other things. Don't focus. Don't put your mind that, okay, they've told me, or this is what it is. Be sure that it's nothing else, and if it is, don't panic. There's always a solution, and there's always an alternative if all else fails.
Okay, let's look at acne.
Okay. Yes, the hormonals could cause acne. That's the truth. Not all of them, okay? Sometimes those on Implanon may complain of acne. But the good thing is those on Level Firm, for example, contraceptive pill, another non-hormonal benefit of that is that it helps with acne. Okay, so those who are on the pill, or remember that you need to talk to a doctor first. Don't say, oh, I have acne. Let me run to my pharmacy. You need to talk to a healthcare professional first to be sure that it's safe for you. And then for those who've had very stubborn acne, it could also give that benefit of helping you clear it. So just like when you're about to have your period, remember that sometimes you break out. These are just natural processes that may just seem prolonged because now you're in that constant state, so to speak. But then the body is a very versatile organism in that it begins to adapt. When this thing has lasted for a while, it takes weeks, about 3 months, sometimes maximum of a year for your body to say, okay, now I found a way to contain this and make it work. And then it becomes something of the past, and the woman begins to enjoy the whole process. So don't give up too soon. That's
okay, it's still Contraceptive Matters with DKC Nigeria, and today we are looking at how to manage common side effects from the use of modern child spacing methods. Like I said earlier on, side effects are the, let's say, what you experience during a particular period, let's say a period of 1 month, period of 2 months, 3 months. It's just for a little time as a result of a method adopted by client A or client B. And don't say because client A is experiencing a particular side effect, you end up with that side effect. Body differs. So before you adopt a method, please see your doctor, see your medical practitioner. So please, we'll take a short break now. When we return, we'll open the lines and read some messages. Please stay with us. Thanks for staying with us. It's still Contraceptive Matters with DKT Nigeria, and today we are looking at child spacing method, how to manage the side effects arising from the use of child spacing method. And like I said, I have a doctor in the house today, Dr. Queen Amina Bioba, who she has been looking at the common side effects we have out there. She has been allaying the fears of members of the public. We've talked about headaches, acne, nausea, breast tenderness, changes in mood, loss of sex drive. So if you're experiencing any of those side effects mentioned, please call in, share your experience with us, share your thought with us. And so We have a call now. Hello, good afternoon.
Hello, good afternoon. Hannah calling from Lekki.
What's your name, please?
Hannah,
Anna. Welcome to the program.
what did you say?
Welcome to the program. What's your question, Anna?
Thank you. Sincerely, this program is for me.
Okay.
The issue I'm having, I am a mother of 3.
Okay.
So I wanted to stop having kids for some time now.
Okay.
So I had this insemination.
Yeah.
Okay.
That was sometime last year.
Okay. Okay.
Go ahead, Anna.
Okay, the experience I'm having is very, very bad.
What experience are you having?
The side effect is I bleed a lot.
You bleed a lot and you're on Jadel.
Yes. And if I'm having my period, I have my period for at least 2 weeks.
2 weeks.
Yes. And with a very, very thick clot of blood.
Okay. Heavy bleeding for as long as 2 weeks and you're on Jadel. Thank you so much, Anna.
Okay, Anna.
So the issue is,
Okay.
because I just removed it. I was scared, so I just have to remove it.
Okay.
Can you hear me very well?
Yes,
Yeah.
we can.
Okay,
Anna.
because I had to discuss it with my doctor that I can't bear it. So I have to be placed on a flagell, white flagell. That's after 3 days of my period. So I really got tired of this flagell. So I just let me take it off.
Please,
So
who
it's
gave you
let
flagell?
me take it off and we'll have other options.
Anna, who gave you flagell?
My doctor.
Was flagell the only drug your doctor gave you?
Sorry?
Was flagell the only drug your doctor gave you?
It's not a drug. It was being inserted in my...
Okay,
in my-
the
in my
pastry.
arm.
That's the only thing you got. That's the only medication you got for your doctor.
Yes, that was the only insert I got.
Okay. Anna, thanks for
Thank
calling.
you for calling. Okay, so
Thank you so much.
you're welcome.
Okay.
So, just like Anna said, like we explained earlier, we talked about earlier, some women have no periods, some women spot with in between, and some women have really prolonged periods. But now, to answer a question, the pastry she talked about, oh, okay, so Adoko might have a reason. Maybe she had discharges or something, some abnormal discharge or whatever it is was treating. But there are medications that you get that help to lighten your period. Some women during this period of transition, like we said, people respond differently.
Okay, please hold your thought. Hello, good afternoon.
Hello?
Hello, good afternoon. Welcome to Contraceptive Matters. What's your name, please?
Good afternoon.
What's your name, please? Lower the volume of your TV set, please.
Can you hear me very well?
We can hear you. Lower the volume of your TV set, please.
It's already done.
Okay, what's your name, please?
This is Toyin calling from Congo.
Toyin calling from Songo.
Yes.
Okay, so please go ahead with your question.
Please, I called the
You did what?
Kopati.
Copper tea. You're on copper tea.
12 years. I was 12 years old. And for 3 years, the something just pulled out myself. And before then, I've been experiencing every flow, 2 weeks, 3 weeks of time, menstruation. So it just pulled off recently with some flesh removed with it. So I went to my doctor. We did scan and all that. They said there's no problem. So I did another one with mouth injection for 3 months.
Okay.
I'm still experiencing every flow. Every flow. Hello?
Okay, we can hear you. Is that all, Toyin?
I'm still experiencing every flow. So at this month, I just did this month, I did one injection more. So my period lasted for 3 weeks. Please, what can I do to
Okay.
reduce or to stop the heavy flow?
Okay. So the flow, is it still as heavy as when you had the Kopati?
I can't hear you clearly.
Is the flow still as heavy as when you had the copper tea?
It feels the same.
Okay.
Okay, it has reduced, but you can feel the pain.
Okay.
All right. Thank you,
Okay.
Toyin, for calling.
Okay, so I'm going to
Quickly,
tie the
okay,
two together.
Okay, yes.
Okay, so there are medications, like we said, that helps to lighten the periods. So
Okay.
these are things that we explore. It doesn't work for every woman. Sometimes we have to switch entirely. So I'm going
Okay.
to tie it to what Tony said. She said she had an IUD in and she was having real heavy flow. We've not talked about the IUD side effects,
Okay.
but for some people, having heavier periods. Now, there are things we need to ask in the beginning. One, what was your period like? We're going to ask you. If you're already having what we consider a heavy enough period, we may not give you IUD to start with because your periods are going to get heavier. Imagine a woman who uses 4 to 5 to 6 pads and bleeds for 5 days before an IUD, okay? She may experience even much more. So we're going to offer something else entirely, okay?
Okay.
So these are the things we need to know. So if she was having slightly heavy but not so heavy periods, she had this, and she said it fell out. There's a high risk of it falling out. One, was it properly placed? Two, during the period, the opening of the womb is open. So that's why we say check it after every period because you could have lost it, okay? Those are the things that can also happen. Now, if she's on injectables, and remember that it's a potential side effect to have bleed. So I'm going to say get properly evaluated. Get properly evaluated. There are other things, IUSs, maybe the combined oral contraceptives, something that can take care of that flow if there are no other issues or something else causing the flow. Because other things, fibroids, you know, some other conditions can be the reason why you're having this flow. So talk to your gynecologist. Get properly evaluated, and there are other methods that have the advantage of lightening up bleeds that you can enjoy.
Okay, so what are some of the side effects of implant methods? Someone just sent in the message.
Okay, so we spoke about that already, the implants, that's one, Jadel, another one. And like you heard from the callers, having heavy flow could happen. Some women have none at all, and some women have spotting in between periods. Okay, so that's, do we have a caller?
I think
that's
we have
one
a call.
of the
I think
ones
we
that
have
we
a
have.
call.
Okay.
Hello, good afternoon. Hello? Hello, good afternoon. Okay, we lost that call.
Okay. So another potential side effect of the implant on the headaches, okay, mood swings, loss of libido. Those are the things we mentioned today. Those are some of the side effects that may come up with the implant on. Okay.
Okay. Hello, good afternoon.
Hello, good afternoon.
Hello, good afternoon. Welcome to Contraceptive Matters. What's your name, please?
My name is Ariola.
Ariola, where are you calling from?
I'm calling from Ikorodu.
Ariola, welcome to the show. What's your question?
My question is, there was a time earlier this year,
Okay.
I went for family planning.
Okay. What method?
It sat in the, I don't really know, I can't remember the name.
Okay.
But they put it in the ham.
Okay.
Okay,
so
that's
implant.
the implant.
The ham. So that month, when I want to have my period, it took like 3 weeks before it stopped.
Okay.
But since then, if I'm having my period, it will take like 3 weeks, 4 weeks before it stops. So please, what can I do?
You've taken out the implant.
Yeah.
You've taken it out already. Okay.
Okay.
No, it's
How,
still there. No,
it's still there.
Yeah.
How long have you had it now?
6 months now.
6 months now. Okay, so if your periods are heavier, I think most of the questions we have
It's
about.
not heavier.
Okay.
It's not heavier.
Okay, so what is the
It's
complaint?
light, very, very light.
And you don't like it light?
Spotting.
It's okay like that. What I'm
It's just longer. The duration is longer than usual.
time.
Okay.
Yes.
Yes. So these are some of the potential side effects of some of the hormonals like we talked about. And there's nothing to worry about. If it's really light, we talked about spotting, that some women may experience spotting. And truly, I've seen people who's lasted weeks to months. Not you can't really call it a period, you can't really call it, but you just find out that they may need to use a panty liner, or every time they go to clean up maybe the loo, they find some spotting. If there are no other
spotting
issues,
is not
it's not just, yes, just some stains. It's very different. If there are no other issues, trust me, it might seem, oh, it's a bit inconvenient, but it's not life-threatening. As long as your hygiene is good and you're handling yourself well, because if that doesn't happen, we may have to start dealing with some abnormal vaginal discharge or something.
Okay.
So talk to your doctor if you are really, really concerned, and then I'm sure he or she will allay your fears as appropriate.
Okay, let's quickly look at some WhatsApp messages. I have a kid and I want advice on family planning.
Okay, so that's why we're here, and I'm sure you've
Okay.
heard the different methods that we have. We have the barrier methods, male and female condoms. We have the injectables. A DKT press is one. We have the implants, whether Jadel, 2 rods, or the implant on NXT, 1 rod. We have the IUD, the IUSs, which are usually put within the womb. Okay, so there's so many options for you. We have the pills, we have the emergency contraception, and then we have the combined oral contraceptive. So there are so many options. Just talk to your healthcare professional, a trained nurse or a trained doctor who can tell you your options, ask you your medical history, and then counsel you about the appropriate method you can use that you can choose from.
Hello?
Hello, good afternoon. Hello. I think we lost that call. I just gave birth and I took family planning injection last month.
Okay.
I was told it will be on 2-month basis, but I have
Okay.
been having abdominal pain since then, and I do see blood during intercourse with my husband. Is it the injection?
Okay, no, I'll say talk to your doctor immediately and get checked. Okay, so because abdominal cramps, you just had a baby. So if you're having cramps, there are 2 things. I don't know how long ago you had this baby. Usually when your womb is going back to size, most women have those cramps. When you're breastfeeding, just your body trying to come back to what it was before you got pregnant. So the pain may vary depending on your pain threshold, okay? And then having what we call postcoital bleeding could be a sign of something ominous, that it's something that might be life-threatening. So definitely
She
see
just
your doctor.
replied now. She
Okay.
said 6 months ago.
So 6 months ago, wow, that's quite a bit of time. But she said she just started injections how long ago?
Last month.
So abdominal pain is a very unusual. You're not even featuring on the list, but now it's coming with postcoital bleeds. That's bleeding after sex. You need to get checked. Probably have a pap smear. Have that cervix looked at, which is the neck of your womb. Get checked immediately. Okay.
Okay,
Very
let's look at the
important.
non-hormonal methods now, starting with IUD. What are some of the side effects?
Okay, so common side effects: heavier bleeds. Okay, we talked about that already on this show, so I'm not going to dwell on that. It could also be more painful. Remember that you have a foreign body in your womb.
Okay, please hold your thought, doctor. Hello, good afternoon. Hello, good afternoon. We lost that call. Okay, please call back. We have lots of calls today, and I think the lines are jamming up. So please call
Yes,
back.
you have a foreign body in your womb, and your womb is going to be cramping up, maybe trying to expel that. So there could be some cramping. Over-the-counter medications usually could take care of that. And there's a risk of puncture, which is why it is absolutely important that the person who is putting this in.
Okay. Hello, good afternoon. Hello, good afternoon. Welcome to the show. What's your name, please? Wow. And I think that's our first mail call today. Okay,
So I said it's absolutely important that the person who's putting it in is a trained professional, because you don't want your womb punctured, you don't want any complication in the procedure itself that could absolutely have been avoided. Okay, so that's another risk. Now it could fall out. Okay, and that's why we say after every period, because at that time the gate of your womb is open. Before you change your vulvar pad or your menstrual pad, you take a look at it, because it's very tiny. It's not as big as most people think.
Okay. Hello, good afternoon. Hello. Wow.
Okay.
Hello, good afternoon. We lost that call. So please.
Also,
I
another
need to
is
round
there
up
may
on
be
that.
some abnormal, if your hygiene isn't great, or if you're having unprotected sexual intercourse with multiple partners, you could also pick up an STI easier, or some abnormal vaginal, notice some abnormal vaginal discharge, okay, that may spread up and cause quite a bit of complication with fertility and the rest. So these are some of the things. So your behavior, your social behavior comes in when it comes to IUDs, and then, like we said, the way your body responds to it. But usually these things are transient, okay, in weeks to about a few months, they settle in. And if they do not settle in, like I keep saying, there's always another way out, basically, another method that you can actually use that may be more tolerable for you.
Okay, I want to know what type of child spacing method I can use. I have about 2 kids.
Okay, so I'm sure we've mentioned that you would have picked that up today. The method depends on you. Like we've talked about, the things to think about. Am I going to be compliant with this thing? Is this something I can easily use and, use correctly and consistently? Is it, how effective is this method? You also want to look at that. Then potential side effects, you also want to look at that. So that's why you have to talk to someone who's trained in this, your healthcare professional. You talk to them, they will give you all the options we've discussed today. And they're going to ask you important questions, because the decisions we make, especially for the hormonals and even for the IUD, which is a non-hormonal, okay, depends on your medical history, your menstrual history, how many partners you're exposed to, certain things we want to know, and then we give you the options that are best suitable from you, from which you can confidently pick one. And monitor you, have interactions over the next few months to see how tolerable it is. If you have any complaints, there are things to help. And usually, if you do that, you'll find out that it's something that you can live with.
Okay, hello, good afternoon.
Hello, good afternoon.
Welcome to Contraceptive Matters. Please lower the volume of your TV set. Hello, good afternoon. Please lower the volume of your TV set, please.
Hello. My name is Abibola.
Your name is Abimbola. You're calling from where?
Ajegunu.
Ajegunle. What's your question, Abimbola? Thanks for calling.
If the person has infection, if you get pregnant, how
If the person, we didn't get that.
if you get it, if the person gets infection and you get pregnant, what the person do?
What can the person do? Did I get you right?
The person gets pregnant and he has infection.
Okay.
Kind of infection.
You want to know if the pregnancy is safe?
Yes.
Okay. Thank you so much, Abimbola. I'm afraid that's our last call for today.
So, I mean, well, it depends on kind of infection, because you didn't specify what kind of infection you're talking about. But no matter what the infection is, okay, there are some infections, okay, if the person has maybe syphilis, for example, or what we call the Touchy syndrome, I won't go into that, but there are some conditions that could be threatening for the child, either cause the pregnancy or the child to be born deformed, if not well treated, or even if not treatable. But the more common ones, if it's even if it's HIV, for example, that's why you have to see your healthcare professional. There are medications that we give so that you and your baby are safe, and your baby is also safe from contracting the disease from you. If it's some other form of treatable sexually transmitted infection, if it's picked on time, your pregnancy could also be safe, and you may have a healthy child. So whatever the infection, if it's an infection of the blood other than one that is sexually transmitted, if it's treatable, don't sit at home and say, oh, I hope I'm fine. Talk to a qualified healthcare professional, get the investigation, blood tests, scans, whatever it is, what that you need to do, and get treated. And if it's not treatable, get managed so that you can get the best possible outcome.
Okay. I think this is where we draw today's curtain. Please log on to www.oniandbanana.com for more information about the various child spacing methods we have. You can also send your questions to DKT's toll-free short code. That's RHS. By typing RHS space, type your question to 38350. You get the swift response. A doctor will actually call you back. We keep having messages. I'm sure the doctor will reply all your messages. Thank you so much, Dr.
Thank you for having me
Hamina
once more.
Thank you so much,
Thank
Anna, Tony, Ariola, Bimbola, and so many people that tried to call in. I'm Olasunbo Modukwe. Please join us again next week for another topic. Please stay tuned.